Hi, everybody. My name is Kadra Abdinasa, and I'm head of Children and Young People's Mental Health at the Centre for Mental Health. Today, I'm joined by Shaheem. Shaheem, do you want to introduce yourself?
Yeah, my name's Shaheem, and I'm a peer researcher for the Center of Mental Health.
So, Shaheem works with us on the Shift in the Dial program, which is an innovative partnership made up of Centre for Mental Health, First Class Foundation, Birmingham Repertory Theatre, and Birmingham and Solihull NHS Mental Health Foundation Trust. The partnership seeks to provide and promote the mental health of young Black men in Birmingham and really shift the overrepresentation of young Black men in acute mental health services and provide more support towards the preventative end. So, Shaheem, can you tell us a little bit about what this briefing focuses on?
Yeah, so this paper focuses on the impact of the pandemic on young Black men's mental health, piecing together the latest evidence and insight on this issue. Why do we choose young Black men? Young Black men entered the pandemic already facing loads of social inequalities and social challenges. Their mental health has also been described by some as the next pandemic coming. It also shows how the programs adapted to work with young Black men during this period of the pandemic.
Yeah. So, just to touch on some of the issues that young Black men have been facing during the pandemic, we know that their learning and education has been severely disrupted by COVID-19. But even before the pandemic started, they faced major inequalities within the education system. So, being much more likely to be excluded from schools or having their grades underpredicted. The pandemic has also impacted young Black men's livelihood, with the young Black men reporting higher levels of unemployment, and some reports suggesting that them being four times more likely to have lost their job.
COVID-19 enforcement and policing are disproportionately affecting young Black men who are much more likely to be stopped and searched and issued fines for breaching lockdown measures. As a result of this, some of these challenges young Black men face are at risk of higher levels of mental distress during the pandemic compared to other ethnic minority groups.
So, what changes are needed? Our briefing calls for urgent cross government action to really tackle the inequalities that young Black men are facing. We're also calling on services to offer tailored support and advice to help protect young Black men's mental health and their future prospects.
Yeah. The NHS should invest in like specific support for young Black men, including working directly with community organizations, like grassroots organizations, because I think they have like um, a more of an insight of work with young people within their communities. I think that they should build more representative of mental health care workforce. So that's like getting, so yeah, a lot of young Black men don't really seek psychological support just because um, they're gonna go in, they're gonna have one-on-ones with someone that they can't really relate to, and I feel like that's similar to like around the board. So meaning that's similar to other ethnic minority groups as well.
Yeah. And we're also calling for more targeted educational and employment support to really tackle the disparities that young Black men face. For example, one of our key messages is that we want to see a moratorium on school exclusions in the aftermath of the pandemic so that young Black men are not further penalized in the education system. We're also calling on the government to launch an urgent review of the policing of young Black men during the pandemic. So please have a read of our briefing and follow the hashtag Young Black Men MH or hashtag Shifting the Dial. Thank you.